Hey guys, Dr. Mike Hansen here. See if you can spot the three critical signs that a heart is in dire straits, desperately crying for help. And watch how fast the AI is going to solve this deadly pattern. Our medical case starts with a 62-year-old man with a history of poorly controlled high blood pressure, type 2 diabetes. He's got a 30-pack year smoking history. So he comes in, he's rushed to the emergency department with severe chest pain. It's in the central region, but it's actually radiating or going to his back as well. So, not just the chest. His condition rapidly deteriorates. His blood pressure in his right arm is 190 over 110. In the left arm, it's 140 over 90. His heart rate is 115. He's got a weak left radial pulse. On exam, he's diaphoretic, meaning he's sweating profusely. He's generally looking uncomfortable. On the chest x-ray, it shows this. And his labs reveal a recent hemoglobin A1C of 9.2%, an LDL cholesterol level, that's the bad cholesterol level, of 165. And on further examination, he demonstrates increased jugular venous distension. When you listen to his heart, he has muffled heart sounds and a significant drop in his systolic blood pressure during inspiration. Let's solve this together using ADH. If you don't have ADH already, don't worry, it's free for our community members. Just click on the link below or somewhere in this video and you'll have access to it. So I ask you, which of the following is a critical sign of cardiac tamponade? Which is to say, yes, this heart is in dire straits, desperately crying for help. Which of these indicates cardiac tamponade? Is it A, muffled heart sounds, B, jugular venous distension, or C, pulsus paradoxus? Or is it D, all of the above? Are all of these indicating a heart that is in cardiac tamponade? So I'm going to copy and paste this exact info that I told you into ADH and see what it says. Within seconds, we have a response. It says, based on the information provided, this case presents a complex medical emergency requiring immediate attention. True. It's crucial to note that this analysis is for educational purposes only and does not constitute medical advice. In real life situations, immediate professional medical care is essential, of course. So the correct answer to the question is D, all of the above. And it breaks down these different signs. So the muffled heart sounds is a classic sign of cardiac tamponade due to fluid accumulation in the pericardial space, which dampens the normal heart sounds. Of course, this is true. Then we have jugular venous distension. This occurs due to increased pressure in the right atrium, causing blood to back up in the venous system. Then there's pulsus paradoxus. While not explicitly mentioned in the question that I presented to you, the significant drop in systolic blood pressure during inspiration describes pulsus paradoxus. So these three signs effectively make up Beck's triad. Technically, Beck's triad is the combination of hypotension plus jugular venous distension and muffled heart sounds. And all of these are strongly suggestive of cardiac tamponade. Now, before I show you the rest of what ADH had to say, I was actually going to ask you what you thought the underlying diagnosis was. It already beat me to the punch, so I'll show that in a second. But let me ask you, what is the most likely underlying diagnosis? And I was actually going to copy and paste this into ADH as another question, but copy and paste the same thing that I already did. But I don't have to because it already actually gave me what it thinks is the underlying diagnosis in this case. And that would be aortic dissection. It says the patient's presentation suggests a possible aortic dissection complicated by cardiac tamponade. Why does it think this? For one, the severe chest pain that radiates to the back. For those of you who are in medicine, medical doctors, you probably already knew. Then it goes on to say that the patient's medical history and recent lab results indicate multiple risk factors for cardiovascular disease, particularly the risk factors for aortic dissection would be hypertension and the smoking history. Then it gives management considerations as well. Maybe you're wondering, how does the aortic dissection cause the cardiac tamponade? Let's ask ADH. Here's an explanation of how aortic dissection can lead to cardiac tamponade. And then it goes on to explain the rapid fluid accumulation of that blood in that pericardial space. Then you have increased intrapericardial pressure and then impaired cardiac filling, and therefore you have decreased cardiac output. And this leads to basically your body goes into shock, cardiovascular collapse. You can't pump blood to the rest of the body. And so this is exactly how it happens. Aortic dissection, it can tear, particularly it can tear one of the coronary arteries that leads to a dissection, and that can cause blood to start accumulating into that pericardial sac. And when you have that blood accumulation there, it basically is compressing the heart, and the heart isn't able to squeeze out as much blood, and you're not able to send blood to the rest of the body. And that's how ADH recognized this deadly pattern in essentially less than 2 seconds. ADH is currently the most medically accurate medical GPT AI in the world. So if you want to use it, again, it's completely free for our members. Just click on the link, go there and sign up, become a member, and you'll have free access to ADH. Stay tuned for more learning cases like this.